Thank you for attending this webinar. I'll get my slideshow going here so that we can go through our presentation here. And today's discussion is on weight management medications. And I've subtitled this as Understanding the Use of Metabolic Medications, Combination Medications, and Long-Term Uses. I'm very excited about this. I have been spending many hours on continuing medical education courses studying these weight management medications, and I'm delighted to share it with our patients. There are many different medications out there that are effective and safe, but more importantly, there are patients out there who struggle to lose weight in spite of exercise and proper diet, and there is definitely a metabolic issue there. And I don't like to call these medications diet pills because they do a whole lot more than that. So let's go ahead here and start looking at our weight management medications. Again, as I've already mentioned, there are individuals with slow metabolism, and these are not diet pills. They increase metabolism. Yes, exercise and diet are critical, but there are many individuals who cannot lose weight in spite of clean eating and proper exercise. So these medications change an extremely complicated and complex physiology of metabolism. This is involved with the brain, the gut, pancreas, and the actual breakdown of fat cells. And some individuals can't do it. That's where these medications come in. And we undergo many metabolic changes throughout life, during adolescence, during the reproductive years, and especially during menopause for women and what we call andropause for men when men lose testosterone. So hormone optimization is critical. But again, there are certain individuals that need medications to enhance metabolism, not only on a short-term basis, but long-term basis. And what do I mean by that? Well, let's talk first about what our goals are. When patients come in for a weight management consultation, we do a bioelectrical impedance analysis of many different parameters: fat mass, muscle mass, body fat changes. We discuss appropriate diets, way to exercise that may be better about enhancing metabolism. We look at labs. We like to look at fasting insulin, hemoglobin A1C, comprehensive metabolic profile, and I do recommend hormone testing because that is critical to optimize that as well. And we see patients for the first visit, and we like to see the patients back monthly for 2 more visits and reach a goal of at least 5% body fat reduction in that 3-month interim. And then we'll continue using these medications if tolerated. Sometimes patients hit plateaus and we have to change it, add different medications. So this is an art as well as a science, to adjust the medications to achieve our goal and to maintain weight loss until we actually reach the weight that we want to be at or what we feel is appropriate for that individual. And once it's achieved, we can continue these medications. And the analogy is if someone has high blood pressure and you put them on a medication, or sometimes 2 or 3 medications to manage their blood pressure, and their blood pressure becomes normal, you don't take them off the blood pressure medication, they're going to have high blood pressure again. Or for cholesterol, you don't take them off the medication, everything's going to go back to what it is. And there are some individuals who need these medications long-term in order to have a good metabolism. So once the goal is achieved, we can, in many individuals, continue these medications or maybe single medication. And we see the patient every 3 months because it is critical to monitor the weight and the vital signs and how the patient is doing on that particular medication. And for our patients who already do bioidentical hormones, there definitely is a reduction in the cost for the first visit if we add this to our protocol. So let's run through these medications briefly. Phentermine has been around since the 50s. It really is an excellent medication. It's very effective, safe, it's inexpensive. It does decrease hunger and increases metabolism. And while the FDA recommends 3 months treatment only, scientists now realize that patients may need to stay on this long-term or even forever, if necessary, to keep metabolism optimal. There are side effects. There can be a dry mouth. There can be dizziness. There can be constipation, sleep disturbances. So we want to take it around mid-morning. It's usually well tolerated. Side effects are not common, but they can occur, and we can dose the medication as needed. It can also be used as needed. We have some patients who just take it on the weekends or maybe every few days, and it can be used effectively that way. It's not indicated in pregnancy, breastfeeding, uncontrolled hypertension, and heart disease. Then there's another old medication, and these are called sympathomimetic medications that phentermine is part of, something called phendimetrazine that also stimulates the central nervous system. It may have the same side effects to phentermine. It can be used in compounded formulations with phentermine to decrease hunger and increase metabolism. It may have less hypermetabolic symptoms related to phentermine. Sometimes we'll use it in combination, and can be used with other metabolic approaches, such as metformin or Victoza or Saxenda, which I'm going to talk about here in just a minute. Diethylpropion is similar to phentermine and phendimetrazine, but it's shorter acting, so you do have to take it several times a day, although there is an extended release. Some patients do better on this. Same contraindications and warnings as the other sympathomimetic medications, phentermine and phendimetrazine. And some patients do better on it. It's trial and error. Orlistat is not very popular. It is an inhibitor of pancreatic lipases and can decrease absorption of other medications. Side effects can be significant: oily, loose stools, increased flatulence. So it's not the most popular medication, but there are patients who do well on it, and it is extremely safe as well. Metformin is something that is used in type 2 diabetics. It's for insulin resistance. We have to look at elevated fasting insulin or hemoglobin A1C. It's inexpensive, safe. There can be some gastrointestinal problems, and it is safe to take with other weight management medications. It's important to titrate it. We start at night before bed and then increase to twice per day. And it is critical to check comprehensive metabolic panel, fasting insulin, and hemoglobin A1C values every 3 months, because there is a rare occurrence for something called metabolic acidosis. Liraglutide is Victoza or Saxenda. It is a glucagon-like peptide agonist. It's a daily subcutaneous injection for insulin-resistant patients. It has now been approved for weight loss and can be extremely effective and used with other medications. Contraindication include a patient who has a history of medullary thyroid cancer or pancreatitis, but it is extremely expensive. Then there are some newer combination medications. Belviq or Lacaserin is something I'm very excited about. For those who remember fen-phen, this is similar to fenfluramine but does not have any of the cardiac side effects, so it can be extremely effective and is less stimulating than the sympathomimetic drugs, the phentermine, diethylpropion, and phendimetrazine. Still can have side effects, but usually well tolerated. And we do have a formulation that's compounded that uses a low dose of phentermine with it. Can be extremely effective. Do not want to give it to patients who have any kind of heart disease, obviously contraindicated in pregnancy and depression. The brand name is expensive, but the compounded one is much more economical. Fusemia is a novel medication combination of topiramate, which is a blood pressure medication and something used for seizures, along with phentermine. Very good for reducing binge eating, good for mood stabilization, good weight loss with it, but it does have side effects: fatigue, cognitive impairment. You can have a bad taste in your mouth, and it's contraindicated in kidney stones, glaucoma, and pregnancy. But some patients do very well on this and tolerate it well. Contrave, which is bupropion and naltrexone, also reduces cravings. It works on a different center of the brain to enhance metabolism. Side effects, again, typically nausea, headaches, constipation, insomnia. You do not want to give it in someone who has uncontrolled hypertension or seizure disorders or drug or alcohol withdrawal. Again, it can be expensive, but there is a compounded formulation since both bupropion and naltrexone are generic. And there are some interesting drugs in the pipeline. Semaglutide is similar to Victoza, but it is longer acting. It's not approved yet. We'll see where that goes. And then an interesting one that's related to melatonin. Metmelatonin works on a different brain receptor, but again, because of melatonin, it can cause tanning skin, headaches. We'll see where this goes. Belnornib is a methionine aminopeptidase 3 inhibitor that may come out in the near future. It has side effects including headaches and insomnia. So let's summarize this. Diet and lifestyle are key, but there are patients who do follow this and still cannot lose weight. Meal replacements, I didn't discuss it, but they can be helpful. Personalized fitness programs may be useful. Bioidentical hormones, optimizing thyroid and testosterone definitely improve metabolism, but there are many medications today that are effective, can be used in combination, and can be given long term. So initially, we will see a patient and do an analysis of body fat, muscle mass with our bioelectrical impedance analysis. We like to do blood testing, including fasting insulin, hemoglobin A1C, possibly looking at hormone panels, 2 more visits monthly, and then after that, every 3 months as indicated. I feel this concept is important to reemphasize. Obesity medications alter physiology, not just behavior. Again, they're not diet pills to decrease hunger, although they do that. They're enhancing your metabolism so that with good diet and exercise, you can lose weight effectively and even long term. So I hope this was useful. If you have any questions, you can call us at our main number at 281-419-3231 or email at info@drbirken.com. Thank you so much.